Hello, and welcome to a discussion of the issues of Campaign 2008. I'm Chris Kiergaard. Representing the views of the Republican Party, on the right, Marsha Livers.
Hi.
And representing the views of the Democratic Party, on the left, Elaine Hopkins.
Hi.
Our topic today is the issue of health care. On the issue of health care, Senator McCain favors a $2,500 refundable credit for individuals, $5,000 for families, to make health insurance more affordable. There would be no mandate for universal coverage, and in gaining the tax credit, workers could not deduct that portion of their savings from the amount taken out for workplace health insurance paid by their employers. Senator Obama favors mandatory coverage for children, but no mandate for adults. He would aim toward universal coverage by requiring employers to share costs of insuring workers and by offering coverage similar to that available to federal employees. He says the package would cost up to $65 billion a year after unspecified savings from making the system more efficient. He would raise taxes on wealthier families to help pay for the plan. By virtue of a coin toss, Marsha Livers will respond first. The Republican view.
I believe the Republican view, John McCain's plan of giving $5,000 tax credit to families to purchase their own medical insurance, gives them a choice in the health care that they receive. I think Obama's plan is more of a socialized medicine to where the government bureaucrats would be the one running our health care system.
Elaine Hopkins.
I disagree totally. Obama is correct in, first of all, moving to insure all children. He could expand the Medicaid program to cover all children and should do that, and I hope he will. Second, he could expand the Medicare or Medicaid program to cover all adults. Now, he's not proposed that. That was talked about during the primary. That's not his plan, but his plan does attempt to move toward universal coverage. McCain's plan will leave millions of people out. And we've all heard the horror stories of people left without medical coverage. It leads to bankruptcy. People die because they don't have medical coverage. I mean, it's dreadful and it's inexcusable in a nation as wealthy as the United States. Small European nations that are smaller than Illinois have universal medical coverage for their people. It's incredible that the U.S. doesn't have this already. Obama's plan moves toward it. It's certainly the better of the two plans.
I disagree. I don't think socialized medicine is the answer. We could receive better health care through innovation, upgrades in technology, and competition in the people in our health care providers. His plan would deter that. There'd be no incentives for new research and competitiveness. We have 3 excellent hospitals in the Renaissance Park area that is going to make the Peoria area as good as or better as Mayo's and the Vanderbilts and the Iowa cities, and without competition and without a free enterprise, I just don't believe that would happen.
Well, this is not socialized medicine. There would be no takeover of doctors or hospitals by the government. It would be a plan that would operate like private insurance or Medicare, Medicaid, where people still choose their own providers. Nobody's talking about taking over doctors and making them government employees. Obama's plan is better because it spreads the risk to more people, and that's what insurance does, spread the risk, so that you pay until you need it and then you get to collect it. I mean, it's really inexcusable that all children in the U.S. are not covered. That's unbelievable to me. And yet McCain voted against that in the Congress, in plans that would do that. So I say let's do it. Obama's right. This is the crucial issue of our time in terms of the economy also. Until we even out the health care issues with the other nations of the world, the U.S. is at a competitive disadvantage, and yet actually McCain's plan is not going to change anything. It really won't. In fact, it might raise taxes for some people as they have to pay tax on the benefits.
No, go ahead.
No, go ahead.
I was going to ask, what do you say about the issue of insuring children? There was an effort in Illinois to do that partially with the governor's All Kids program, and you saw the difficulty it faced simply at a state level.
Right.
How would one expand that to a federal level without that same resistance?
Well, I think it has happened in Illinois. I mean, I know children who've benefited from this. I mean, this nation can afford that. There are lots of inefficiencies in the system. Obama's right about that. He would get rid of the ridiculous idea that Medicare cannot bid for prescription drug coverage. That's unbelievable that that was passed by Congress. And he would get rid of that. That would save a lot of money. There's money in the system. The U.S. spends enough money now to cover everybody. It's just that a lot of that goes to expensive insurance company executives and medical infrastructure, whereas it should go to providing care.
Well, in Illinois, we have a system of child care for children, and there's no money to pay the pharmacies, the medical providers, and that's probably much like what it would happen as far as the federal government running it.
Well, the federal government has vastly expanded resources. Some of these state plans have had trouble. There's not enough money in state government to do some of these plans adequately, but that's not true of the federal government. I mean, look at the money we're wasting in Iraq. If that money were directed toward health care, we'd all be covered.
Is $5,000 enough, given what a typical family pays? Is it enough? Is it just throwing them a bone, a small incentive?
I really wouldn't be able to answer that, I mean, for the candidate, but I think that there's a lot of employers out there who are already providing adequate health care for their employees, and take them out of the picture, and there might be money to fund for underinsured families.
All I can say is there are said to be 50 million people now without health care insurance coverage. And there's enough money in the system, I've read this, to cover these people if it's done right. That's what Obama proposes to do. It's the most serious economic issue the country faces, except perhaps for the credit meltdown. And it needs to be dealt with. At least he's got a plan to do it. I think nothing will change under McCain. We'll just muddle on as we do. Because I don't see Congress even approving his plan. They wouldn't do it. People would be so opposed to that.
Maybe not a Democrat-controlled Congress.
They say the Republicans are not going to be able to take control of Congress, although you never know.
Okay. Thank you both.